CEO Esther Munia, who will be speaking on case updates, cases identified from yesterday, November 25. And then after that, she'll be taking questions. All right, CEO, whenever you're ready, take it.
Okay. Okay, so I just wanted to provide you guys some updates. There's 43 additional individuals that have been confirmed positive. This brings the total to 692 cases since March 28, 2020. We have 43 new cases identified yesterday, November 25th. 24 were via community, and 2 were out of the 24, 2 were through the emergency room entrance. 19 were via contact tracing. There's 33 that were fully vaccinated, 2 ineligible, 1 partially vaccinated, 7 unvaccinated. 669 tests were conducted on November 25th. We're urging everyone for community-based testing to visit our website, covidtesting.chcc.health, and we will be announcing more slots for all of next week. Currently, there are 3 individuals that are hospitalized as a result of COVID-19. These 3 are unvaccinated individuals and all being actively monitored. Again, we are encouraging everyone to please get vaccinated, unvaccinated individuals to get vaccinated against COVID-19. It is free, it is available. We're trying to make it more accessible for everyone to come in. It prevents severe illness, hospitalization, and death, and even against the widely circulating Delta variant. Since October 28, there have been 401 new cases, of which 173 were identified via contact tracing, 216 were identified via community testing, and 12 were identified via travel testing. So again, just an update and to answer any questions. One more thing, the multipurpose center is open to administer COVID vaccines Monday through Saturday, 8 to 4 p.m. Except for today, they're closing at 11:30, but it will go back to normal hours starting tomorrow. And register again online through vaccinate CNMI.com or call 670-682-7468. Thank you.
All right, folks, we'll take questions. All right, Tomas, go for it.
And I think it might be helpful, Gil, if you're able to just send out maybe what the CEO read, just because it was, I know it's numbers, I want to make sure we get them right. It was a bit echoey, I couldn't get the numbers right on my end. But wanted to just follow up, CEO, on the targeted vaccination that you mentioned when the first cluster was announced. Can you give us an update on targeted vaccinations and what that's looking like now?
So we are going to be pushing out more vaccinations for kids as well at the schools. These are for 5 to 11 and 12 and up as well. We're also going to be, we will also be making some arrangements starting next week. So those are going to be done next week.
And can you tell us what are you looking for with these targeted vaccinations, or any specifics in terms of what you mean when you say you're targeting particular communities or populations?
Sure. So obviously we want to reach out to anyone in a congregate living situation and try to encourage them to get vaccinations. So we are going to be literally knocking on their doors, and working with businesses as well, especially with large employment. That we want to be able to try to reach out to them and see, what can we do about making the vaccinations more accessible. We are doing that already for the kids, obviously, with the new schedule for the schools, and we want to do the same for the adults.
And if I could just ask you for your message to the community, I think, especially those who might be saying vaccinations don't stop the spread. Seeing a lot of those comments. Can you address that?
I'm sorry, what did you say? Can you read that?
Can you address some commenters who are saying that vaccinations do not stop the spread of COVID?
So, I mean, obviously, a vaccinated individual can transmit the virus, but as what we're seeing right now, we are seeing hospitalizations for those that are unvaccinated. The ones that are vaccinated have mild symptoms. We also want to encourage anyone who's eligible after 6 months of getting their second dose to start looking at getting their boosters. Those we're seeing again the waning efficacy of the vaccines beyond 6 months. So we want to urge everyone. You're probably not going to stop the spread, let me just tell you, by just getting vaccinated, but it definitely protects you and protects your loved one from, getting severe illnesses and hospitalizations. We're providing treatment. I want to mention that we are providing treatment of monoclonal antibodies right now. I believe there's 4 at the Canoa site, and we want to prevent hospitalizations. So we really do need, as much as possible, we need to go work together. We can provide the treatment, but again, if you're not vaccinated, there is that more risk for hospitalizations and severe illnesses. That we can see already. It's right in our face.
All right, thank you. Also, just the audio is not the best. I just want to make sure folks can hear your message loud and clear. But yeah, just a heads up.
Okay. Sorry, I have to take this call out here. We're trying to get messaging to you all today versus waiting till another day. So, sorry about that. He said that the sound is not so good.
Yeah, thank you though. That's all my questions. Appreciate it. Thank you.
So, I mean, that's it.
Sally, I think you're muted.
Sally?
Hello. I'm not too sure if you mentioned clusters of
What was that?
the clusters.
The clusters, do you want to, what about the clusters?
How are these individuals related to the clusters that Stephanie mentioned, like in the living?
Yeah, I think what we're trying to, the clusters are all, I mean, the cluster started out as a small cluster, but as Delta variant, basically the action of the Delta variant here is the same action you find anywhere else. You will find a spread to other people. The clusters always continue to expand. One of the things that's really making our job, especially the contact tracing job, harder is when individuals who are identified as positives do not provide the adequate information. Again, we're trying to reach to everyone to save their lives by having these treatments available to them. So if you are not providing the information of your contacts, you're practically putting them at risk also. So you need to be truthful about the information that you provide to us, because that's how we can get to them. They're able to detect, get their identity, whether or not they're positive or they're negative. But if they're positive, there's a time frame on when we can provide the treatment. So if you know a contact and you are positive, you need to please help out our contact tracers so that they can reach out and try to test them as quickly as possible. We have individuals that are not providing adequate information or incorrect information, and that doesn't help, because what we're seeing, these cases will continue to rise, and we'll continue to see these cases spread. So it's not just about the clusters anymore. We're talking about individuals that are out there probably not knowing that they're infected. So we really need to get people to be truthful and let us know so that we can test them and so that we can contain it as quickly as possible. But we can't do that if you are providing misinformation or lack of or withholding information.